Good afternoon, everyone. For the record, Delegate Jazz Lewis here for the NETS meeting of the Public Safety and Administration Subcommittee. We have 4 agencies with us today. We are going to begin with the Division of Pretrial and Detention Services. So can we have Ms. Barber come and do the DLS analysis, and afterwards we'll have the Secretary provide testimony. Good to see you all.
Good afternoon. My name is Catherine Barber, and today I'll be presenting the fiscal 26 budget for the Division of Pretrial Detention and Services within DPSCS. The fiscal 26 budget totals $377.6 million, which is a decrease of $11 million or 2.8% from the working appropriation. I'll start with a brief performance analysis. In Baltimore City, all arrestees are processed at the Baltimore Central Booking and Intake Center, or BCBIC. The past decade saw an overall decline in activity through BCBIC, which is consistent with trends that we've seen in other areas of DPSCS. Exhibit 1 on page 4 shows the number of individuals processed and the rate of commitment. There were 15,385 individuals processed in fiscal 24. Arrestees processed decreased by 2%, commitments increased by 8%, and the rate of commitment, or the share of processed individuals required by court order to be detained until their trial, increased by 6 percentage points to 59%. In addition to the pretrial detainees held in Baltimore City, DPDS holds some sentenced offenders in its custody. Exhibit 2 on page 5 shows the ADP of sentenced offenders, local pretrial detainees, and federal pretrial detainees in Baltimore City for the past 10 years. Since fiscal 2017, the overall population under DPDS jurisdiction has not changed significantly. Fewer defendants are being held for longer periods, resulting in a leveling out of the average daily population. The length of stay for DPDS facilities was 13.2 months at the end of fiscal 2020 due to the pandemic slowing decisions by the courts, but has improved to 3.5 months on average as of July 2024. Assaults have increased significantly in pretrial detention, driven by the Metropolitan Transition Center and the Youth Detention Center. Exhibit 3 on page 6 shows the approximate number of individual-on-individual assaults within DPDS facilities over the last decade. In fiscal 24, 4 facilities saw decreases in individual-on-individual assaults compared to the prior year. However, MTC and YDC reported significant increases of 48% and 58% respectively, which drove the overall assault rate up by 6% to 30.7 assaults per 100 ADP. Despite having an ADP of only 98, YDC had an assault rate of 68.37. This is nearly double the rate of BCBIC, which had the second highest assault rate in fiscal 24 at 36.9. Additionally, from fiscal 23 to 24, the individual on staff assault rate increased by 17.4% to 11.92 assaults per 100 ADP. The level of safety in facilities is impacted by the state of the workforce, which has been strained from years of high vacancies and growing mandatory overtime. Tired employees are less likely to pick up on dangerous situations and can even contribute to danger through negligence. On a more positive note, the pretrial release services program continues to meet its goals to ensure that pretrial defendants released into the community comply with their bail conditions, do not engage in criminal activity while on release, and appear for court when required. Exhibit 5 on page 9 shows that PRSP staff successfully met the goals of having 4% or less of its population arrested on new charges while under supervision, and having 8% or less of the population fail to appear for required court dates in fiscal 24. 3% of defendants were arrested on new charges and 2% failed to appear in court. Moving on to the budget, Proposed general fund deficiencies for fiscal '25 total $116.6 million. The three largest deficiencies are $58.1 million for the cost of inmate health care following a change in the medical and mental health contractor, $49.4 million to supplement overtime costs that were higher than anticipated, and $7.3 million to address fiscal 2024 shortfalls in operating costs. 61% of the $377.6 million allowance supports personnel costs for 1,755.6 regular positions and 21 contractual positions. Inmate health care accounts for approximately 28% or $107.9 million of the allowance. The allowance is broken out by major spending area in Exhibit 6 on page 11. The fiscal '26 allowance decreases by $11 million overall from the working appropriation, but after accounting for proposed deficiency appropriations for costs associated with fiscal '24 shortfalls, the budget decreases by approximately $3.8 million. One driver of the change is personnel, mainly due to the transfer of 32 positions out of DPDS. Partially offsetting the overall decline is an increase in inmate healthcare costs, and Exhibit 7 on pages 12 and 13 shows the breakdown of the changes. 32 regular positions are transferred to other DPSCS offices, mainly to administration and offices. Correctional officers make up the majority of these transfers out of DPDS, along with several mental health, social work, case management, and office support positions. Some administrative and office support positions were also transferred into DPDS, partially offsetting the transfers out. As of December 31st, 2024, DPDS had 178.6 vacancies, a rate of 9.99%, and the majority of these were correctional officer positions. Exhibit 8 on page 15 shows vacancies by facility. The first issue in today's analysis is about compliance with the Duval v. Moore consent decree. In calendar 2015, the ACLU filed on behalf of Jerome Duval and other detainees to reopen a partial settlement agreement regarding conditions at the former Baltimore City Detention Center, now BCBIC and MTC. The state agreed to overhaul the jail's healthcare system and make major improvements to the facilities, including accommodations for people with disabilities. Appendix 1 on page 20 lists the compliance provisions outlined in the decree, and this decree has been extended 4 times since 2020, most recently from June 2024 to June 2026. In September 2018, a court-assigned monitor declared that DPDS reached substantial compliance in all 3 areas of the physical plant requirements, and as of August 20, 2024, DPSCS was deemed in compliance with 9 of the 12 mental health provisions. While the extension of the decree deadline has protected DPSCS from additional potential lawsuits, the process has not been without cost. According to DPSCS, costs related to the decree total nearly $1 million between fiscal '23 and '25. These costs are broken out at the bottom of page 16. As of the 2025 session, no new motions have been issued, but this litigation has a history of over 741 total motions. DPDS is in substantial compliance with 15 provisions, partially compliant with 27, and non-compliant with 9 provisions. The division has failed to meet the requirements of the consent decree for many years, and the state cannot expect the court to perpetually extend the deadline. DPSCS should comment on the steps taken in the past year to achieve greater compliance with Duval, including a discussion of the effectiveness of third-party consultants and an expected timeline for compliance. DLS recommends adding language that restricts $100,000 in general funds pending a report on DPSCS's strategy to reach full compliance with Duval. The report should contain updates on all provisions and any motions issued between fiscal '24 and '26. This recommendation appears on page 19. The second issue in this analysis discusses DPSCS's contract with the U.S. Marshals Service for the operation of Chesapeake Detention Facility. Chesapeake Detention Facility, or CDF, is a maximum security facility exclusively for federal pretrial detainees, and DPSCS has operated CDF on behalf of USMS since fiscal 2012. The contract with USMS was established for the period of September 1st, 2010 to August 31st, 2025, and requires that DPSCS provide all necessary personnel, equipment, materials, supplies, and services for the facility. The contract is a fixed price agreement adjusted every 2 years based on the Consumer Price Index. DPSCS has unsuccessfully attempted to renegotiate the active contract in the past, primarily due to a lack of responsiveness and engagement from USMS. The current contract is not subject to adjustment based on the actual costs paid by the state. Not only is the contract structure not financially advantageous for the state, the detainment of federally charged individuals is not a state function or priority. USMS funds CDF operating expenses through the agreement, but the funding has not always been adequate to support all CDF expenses. Exhibit 9 on page 18 shows the amount of federal and general funds needed to fully operate CDF since fiscal 2017. As you can see, expended general funds between fiscal 2019 and 2024 totaled $33 million and are budgeted to almost double due to projected spending of $30 million in general funds in fiscal 25 alone. The fiscal 26 allowance budgets $19 million in general funds for CDF. The agreement with USMS is set to expire on August 31st of this year. However, DPSCS has stated that it intends to renew the contract with a higher reimbursement rate. DPSCS met with USMS on February 18th, 2 days ago, to renegotiate the reimbursement rate, which would go into effect on September 1st of this year, upon the expiration of the current agreement. DPSCS should discuss the outcome of the meeting with USMS, as well as the reasoning for renewing the contract and the agency's strategies to reduce the need for general funds in fiscal 25 and 26. This concludes my presentation. Thank you.
Thank you very much, Ms. Barber. Colleagues, any questions for DLS? Seeing none, Madam Secretary, you and your team can approach and begin when you are ready.
Good afternoon, Chair Lewis, members of the committee. For the record, my name is Carolyn Scruggs, and I'm the Secretary of the Maryland Department of Public Safety and Correctional Services. It's my pleasure to be here in front of you again today. With me is Deputy Secretary of Administration, Joseph Sadal. As always, we appreciate the collaboration with the Department of Legislative Services and Ms. Barber's effective work that she does on our analysis. I'd also like to offer again a thank you to DBM analyst Christina Jorge Chuyon for her advice and guidance during this process. The analysis contains 2 issues for the department's response and 1 recommendation. DLS has requested the department provide a compliance update for all Duval provisions and the number of motions issued in fiscal years 24 and 25 to date. DLS has also requested us to comment on the steps taken in the past to achieve greater compliance with Duval, including a discussion of effectiveness of third-party consultants and expected timeline for compliance. Since becoming the Secretary of the Department, complying with Duval settlement has been one of my closest and highest priorities. I'm hopeful that the actions taken by the Department during my tenure will allow us to reach full compliance. I'd like to take some time to provide a brief history of this settlement agreement and offer context and scale of the undertaking the Department is currently engaged in. The case began in the 1970s when the city of Baltimore operated the Baltimore City Jail. The current iteration of the case began in 1994 under Governor Schaefer and Governor then Glendenning. In 2003, the ACLU filed a class action lawsuit on behalf of the detainees within the Baltimore City Booking and Intake Center. A settlement with the ACLU was reached in 2009, reopened in 2015, and remains ongoing. Most recently, August of 2024, the court extended the period of the agreement to June 30th of 2026. It is an understatement to say that this process has been a tremendous undertaking. Since becoming the secretary, the department has made significant changes to the scope and scale of the provision of medical and mental health care provided to our detainees at BCBIC. To name a few of the improvements made during my tenure, the department has entered into a new medical and mental health care services contract that substantially increased the required professional staff within the facilities. The department has identified special assignment posts for medical liaison officers within the facilities to assist with the coordination and care between custody and contracted medical staff. The department has also made upgrades to the electronic patient health record system to ensure appropriate tracking of medication disbursement. We will continue to make constant improvements. The department cannot definitively project when substantial compliance, as dictated by the court, will be reached for the medical provisions of the settlement agreement. This is due to a one-year gap where a court-ordered medical monitor was not in place following the abrupt resignation of the previous monitor in December of 2023. The court has recently appointed a new medical monitor. The department maintains its substantial compliance with the provisions of the settlement agreement and looks forward to demonstrating this progress to the new monitor for their determination. Their first report is due May of 2025. For the mental health provisions, the current mental health monitor has deemed the department in substantial compliance with 9 of the 12 mental health provisions and in partial compliance with the remaining 3. The department is hopeful that these final 3 elements will be deemed substantially compliant at the time of the monitor's next visit, which is November of this year. DLS has requested the department also comment on the outcome of the meeting with the USMS Marshals, as well as the reasoning for renewing the contract. The department met with the United States Marshal Service Office and the Prisoner Operations Division this week to begin discussion regarding the current Chesapeake Detention Facility. The current agreement with the U.S. Marshals will expire August 30th, 2025. The department has just begun contract negotiations. We are awaiting a proposal from the Marshals, which we expect to arrive within the next 2 weeks. We endeavor to work with the federal agency to ensure that the best deal possible is made for the state of Maryland. And we also concur with any recommendations or actions that have already been spoken about from Ms. Barber. We're happy to answer any questions that you have.
Thank you, Madam Secretary. Colleagues, do you all have any questions? Okay. I will ask the questions that I have. Can you speak a little bit to the increase in the assaults that we've seen? You know, I know it was on the downtake, then based off of the data we saw that it had been increasing. Can you speak to that just a little bit?
So if you notice, we basically work on the arrest trends based on what the police does. And so what we're seeing is more assaults on person because of the crimes that are coming in. We're not seeing a lot of the misdemeanors come in that we normally see. And so the individuals that are coming in, even in our juvenile facility, they are charged with the #1 crimes. They are the same individuals that are expressing these behaviors in the community. So their behaviors have not changed. So the assaults are increasing. Many of them think they're going home because they haven't been sentenced yet because they're in a pretrial facility, and they take advantage of that.
It seems like we have been pretty effective for the folks who are being released and limiting some of, I think, those criminal activities going back to. I think that was referenced in the analysis. Can you talk a little bit to the strategies you guys, I guess, employ as they're exiting to return to the community?
So there's definitely the first major one is a continuity of care with their medical needs. Before everyone is leaving, there is a medical screening that is done that allows us to provide a continuity of care if we were servicing them while they were there. It allows them to get 30 days of medication, and we connect them to a community partner so that they can continue to get that medication. We also have brought on social workers that will allow them to enroll in any opportunities in the community so that they can cover their medical costs.
Awesome.
That's the biggest one. That's really because most of the people that come to us have some type of outstanding medical issue or mental health issue that's not being addressed in the community, and to be able to connect them to that resource that they never before knew how to connect to, that's big for them. It really helps them.
All right, colleagues, any other questions for Madam Secretary? Seeing none, thank you.
Thank you.
All righty, so we are going to, oh, we do have one witness here. Actually, let me see. Oh, Ms. Francis with Ask Me Local 3661. Sorry, I almost missed you. Please approach and you can begin when you're ready. Thank you for joining us.
Thank you for having me. Good afternoon, everyone. My name is Janiyah Francis. I am the Secretary for Local 3661, and I am also a pretrial release investigator for the Bail Review Unit. And I am here today to highlight the ongoing challenges faced in our department and the need for critical investment to support staff and ensure safe and effective workplace. Right now, our department is struggling with a high turnover rate. Past leadership set the expectation that staff would leave, and unfortunately, that has become the reality for our department. Without meaningful action, this cycle will continue and make it harder to retain experienced employees and provide consistent services. Another key issue is the lack of formal training for our staff working in the facility that houses incarcerated individuals. Despite multiple discussions, over the past 2 years, little progress has been made. Proper training is essential as we are meeting with offenders daily and making recommendations on their release, not only for the staff safety, but for the overall security of the facility. Additionally, we lack the necessary resources to perform our jobs effectively. Technology is outdated, and while we were promised Surface Pros to increase flexibility, we instead received desktops, which have limited our ability to adapt to operational needs. These kinds of oversights impact efficiency and productivity. We are asking for targeted investments in staffing, training, and resources to improve workplace conditions and ensure staff have the tools they need to succeed. Addressing these issues will lead to better retention, safer environments, and a more effective system overall. Thank you for your time and consideration.
Thank you. Any questions? Whoa, don't leave just yet. Colleagues, you have any questions for her? No? All right. You got let off easy. You're good. Have a good day. All right, now we are going to move along to the State Board of Elections. Ms. Rye, if you can begin your analysis, and then I think I saw the administrator. After she finishes, then you can approach.
Thank you, Mr. Chair, committee members. Today, I will be presenting the fiscal 26 budget analysis for the State Board of Elections, or SBE. SBE is a 5-member board charged with managing and supervising elections in the state, registering voters, and coordinating candidacy. Its key goals are to ensure that all eligible Maryland citizens can register to vote and to provide voting process that is convenient and accessible. The cover chart on page 1 shows that the budget for SBE decreases by about $15 million in fiscal 26 compared to fiscal 25. This is because the reimbursable fund in fiscal 26 reduces by $11 million, which is related to the fiscal 25 reimbursable funds for SBE's major IT projects. In fiscal 26, these amounts are budgeted under the Department of Information Technology's budget and will be added to SBE as reimbursable funds during the fiscal year. At the bottom of page 2 are 4 key observations on SBE's major IT projects that we will discuss later in the analysis. Moving on to performance analysis, on page 5, Exhibit 1 compares voter turnout in the 2024 presidential general elections with the 2016 and 2020 presidential general elections. As you can see here, there was a significant increase in mail-in voters in 2020 due to COVID. In the 2024 presidential election, there was a bit of balance between the different voting methods, except for provisional voting, with election day seeing about 1.1 million voter turnouts. On page 6, Exhibit 2 shows the registered voters and participation in the presidential elections from 2004 to 2024. Voter participation rate in the 2024 presidential general election decreased by 2.2%, and participation in the presidential primary election declined by 14.4% compared with the 2020 presidential primary election turnout. On page 7, Exhibit 3 shows the total fiscal 26 allowance for SBE, which is about $54 million. Of this, about 39% supports necessary equipment and supplies for election operations. This includes processing voter registrations. Exhibit 4 on pages 8 to 10 highlight the proposed budget change. The largest decrease of about $21 million is due to the estimated carryover of fiscal 25 appropriation for the new voting system major IT project. This is partially offset by about $1,200 million each in training election staff in preparation for the next election cycle in 2026, including election telecommunications. Page 11 highlights personnel data. The fiscal 26 allowance includes 1 new regular position to serve as the communications director. As of December 31st, 2024, 3 vacant positions were reported, which have been unfilled for less than a year. Pages 12 through 16 highlights all the 4 major IT projects, which includes 1 proposed new IT project. The first one on page 12 is the statewide poll book modernization project, or SPM. As reported in last year's analysis, the previously contracted vendor for the new poll book project did not deliver a product that met minimum requirements during product testing. This led to the termination of the contract in February 2024. In its first quarterly report dated July 15, 2024, SBE noted that the new poll book project was closed as of June 30th, and a separate SPM project began on July 1st of 2024. SBE notes that a portion of funds would be held for pending litigation. We request SBE to comment on how much funding is being retained for pending litigation and provide an update on the process. SBE plans to implement the new SPM project for the 2028 election cycle and expects to issue RFP in March 2025. Regarding the project cost, as this project replaces the previous poll book project, the fiscal 25 working appropriation of $1.9 million was transferred to this project. Fiscal 26 allowance includes $3.2 million for the project with local share that equals 81.6% or $2.6 million. The poll book costs are generally split equally between the state's general fund share and SBE's local share. SBE notes that the agency will work with the Department of Information Technology to correct this fiscal 26 allocation. The revised estimated total project cost is $38.1 million, which is 71.6% higher than the previously approved poll book project. Concern remains on the issuance of RFP in March 2025 and the targeted project implementation by 2028 election cycle. We request SBE to comment on its contingency plan if the RFP and targeted implementations are delayed. The second major IT project on page 13 is the new voting system. Originally, this project was scheduled to be implemented before the 2026 election cycle. But a new standard was adopted by the U.S. Election Assistance Commission that certifies voting systems in November 2022. Because no vendors have currently completed this new certification, SBE extended the current contract to March 2027. SBE plans to issue an RFP for the project by July 2025. The fiscal 26 allowance for the project includes $50,000 in do-it oversight. No funding for the project has been budgeted for fiscal 26, as SBE anticipates carrying forward about $19 million from the fiscal 25 working appropriation. The total estimated project cost is $48 million, which is 12.7% lower than previously estimated during the 24 session. We request SBE to comment on 1, the decrease in estimated cost for the project, and 2, the implementation schedule for the new voting system for the 2028 presidential election cycle. Because both SPM and new voting system are planned to be implemented during the 28 election cycle, there is a concern on how 2 major IT projects will be implemented effectively and successfully simultaneously. We request SBE to discuss efforts to mitigate impacts of implementing these 2 IT projects at the same time. On page 14, the third major IT project is the new campaign information system project. The current contract for the campaign information system will expire on March 31st, 2025. A vendor has been selected and approved by the Board of Public Works on January 29th of this year. SBE expects to set up a temporary new CRIS by April 1st, 25, and anticipates a newly designed system to be in place by July 1st of this year. A comprehensive transition plan is being prepared in collaboration with the existing vendor to ensure a seamless transition to the new system. We request SBE to provide an update on the next steps for the project following the approval of a new vendor. The project's total estimated cost is $1.2 million and receives about $572,000 in general fund in the fiscal 26 allowance, and this project is expected to be complete in fiscal 26. DLS recommends adopting committee narrative requesting combined quarterly reports on the progress of each of the 3 above-mentioned major IT projects. On page 15 is the new major IT project starting in fiscal 26. This project replaces and modernizes the current MD voters that serves as a single system that stores and manages official registered voters list. This project is anticipated to complete implementation by fiscal 2030, and SBE plans to onboard a dedicated project team in fiscal 26 and begin drafting RFP for the project. The estimated total project cost is $35.6 million. And the fiscal 26 allowance includes about $600,000 for the state's share and about $471,000 for the local share contained in SBE's budget. As discussed earlier, SBE currently has 3 major IT projects in process, with 1 project completing in fiscal 26 and 2 projects anticipated to be implemented in 2028. Considering the multiple delays in implementing the ongoing projects and the potential strain on SBE's staff and resources for another new project, DLS recommends deferring the new voter registration project and deleting the fiscal 26 general and special funds budgeted for the project. On page 17 are the 2 DLS's recommended actions. On page 18 is an update on the expanded opportunities for pre-trial facility voting as requested in the 2023 JCR. According to the report, SBE surveyed state and local correctional facilities as well as LBEs to identify successful practices, issues, and potential challenges. As a result, SBE tailored its election communications to detained individuals to make all voter outreach information materials more accommodating and useful. Some of the challenges identified were fluctuating number of incarcerated individuals, limited staff and storage space, and the lack of established processes like providing materials or picking up voted ballots from these facilities. For the 2024 elections, SB reported that voting packets were made available at the correctional facilities, and a total of 126 ballots were returned for the entire 2024 election cycle. Pages 19 to 25 are appendices, and this is the end of my presentation. Thank you.
Thank you, Ms. Roy. Colleagues, any questions for DLS? All right, seeing none. Jared, Mr. Administrator, you and if any colleagues are going to approach, if you can come on now. You can begin when you are ready.
Jared Tamaris, State Administrator of Elections, for the record, and with me is Catherine Berry, the Deputy Administrator, and Shelley Holland, who is the Director of Budget and Management for us as well. So with this, I just wanted to, I've submitted written testimony for you, but I just wanted to make sure some highlights of it. Most notably, this is my first time addressing you about the post-2024 election, and just wanted to give you some overall highlights of it. We had a very successful voter outreach campaign with the dynamic Vote MD website, which was really successful. It was, I think, very user-friendly, and the landing page allowed users to seamlessly put on important dates right onto their calendar, such as voter registration, early voting, election day. And they had all the links to the locations so that they can get maps and everything to go vote. It also was a part of our program to inform them of the 3 different methods of voting besides in person, which you have on election day, but also early voting, but mail as well, and all the drop boxes there. The outreach was just a phenomenal, which we put in some of the stats in our testimony for you here. One I just want to mention is that we had, I think, 7.3 million plays of digital ads on Facebook and Instagram, and with 2.8 million of them reaching specific Meta accounts in Maryland voters. So I just want to mention that, we specifically hit almost, 3 million people right there, and there's only 4.1 million registered voters. So, we really helped targeted and, making sure that they got the information as possible. One of the bigger things too, which was in confronting the 2024 election, was combating dismiss and malinformation. And with the strategy we had with the new outreach program was also to make sure that SBE is the trusted source of information for the public during the election cycle. And we did many press interviews, press releases, and building our social media presence in our efforts to combat that. And that was part of changing the culture and being open and transparent. We did that with our rebranding of our logo. It has 7 stars for representing Maryland as the 7th state. And we also have a new motto, too, that when you look at all the letters, spell vote. And one of the things is about being open and transparent in that process there. We have worked particularly to improve relationships with the state board members, because in the past there's been some issues with giving information to the state board, as well as really working with, in collaboration with the local boards of elections. We've had numerous meetings with them. They've been engaged in the process, and it's been a collaborative effort which made 2024 a very successful election for our president, and we're looking forward to moving forward to 2026 as well for your election. The one thing the DLS analysts always forgot was, which is something near and dear to my heart, is campaign finance. That's our mission as well, so make sure you always follow your reports. But with that, one of the things, too, is that we recognize that there is the budgetary deficit here. We did, one of the things to help with this was, recognizing the realities of the hybrid workforce. We relinquished some of our office space in Annapolis here, so we shrunk our size to accommodate more hybrid work schedules, so people are sharing offices, so we don't have to pay extra rent on that front there. We're still having the presence at 151 West Street, but it's going to be a smaller unit, so that helps out with the budgetary issues there. We are following the current federal landscape that is out there that has caused some trepidation and consternation with some of our future election assistance commission, and other federal funding programs and grants that we received there. But right now, we have fully been funded with those. So, but we are monitoring that, daily on that. One of the things is that we are committed to making sure that Maryland elections are safe, secure, and transparent, and always maximizing our technology and cybersecurity in order to ensure this. As you know, in 2024, Maryland was a targeted state for suspicious packages, threatening letters, and bomb threats. One of the other things, too, I just wanted to give you some stats about the 2024 election, was that Marylanders, 55% of them chose to vote early before Election Day, with 880,000 mail-in ballot requests. And while in-person voting is still the primary way of the way people want to vote, in the general election, mail has been particularly successful in primary elections. And we're now looking at it for a little bit more analysis on whether or not that is due to when the primary occurs. Mostly in the summertime, more people are away, to see if that was one of the reasons why. But post-COVID right now, you only have 2 data points here, 22 and 24. So as we get a little bit more, but I'm analyzing those trends right there. But those were kind of some of the bigger things there. We've put in more stats for you. Happy to answer any of those questions. Additionally, one of the things for budgetary purposes is that we have a public financing program. It has to be fully funded to the tune of $9 million. Last year, in 2023, it was there was a deficit to get to the $9 million, but through our enforcement actions, we have gone over the $9 million, so you do not have to appropriate any funds to that. And we are helping with all the interest payments are being directed directly into the general treasury to help, again, with the budget deficit. So we're trying to do our part as our small little agency can when we're there. With this, I will address some of DLS's questions here. First up was how much funding was being retained for potential litigation. That is $100,000 is being set aside in our budget to help maintain any litigation. And we are currently on the contingency plans for the poll books. We are currently using the current poll book solution. One of the things is that I want to make sure you're aware of, and why this is a pressing issue for us, is that we have procured all the poll books available that have ever been made that are still functioning in the entire United States. So they're all here in Maryland. But they are workhorses, but right now we are towards the tail end of their life expectancy. And, but they will be able to be used and will be functioning well for the 2026 election. The one point that she mentioned was the commenting on the decrease for a new voting system. In fact, I don't think that will be the case. The opposite will be more the case. The new EAC standards for the voluntary voting system guidelines 2.0, the vendors have said through their trade association representatives that to expect at least a 20 to 50% increase in cost from your current system. I expect it's going to be more towards the 50% mark. So that's going to be something that we're monitoring and moving forward with it as well. But right now, as mentioned earlier, there is no voting system that has been certified to the 2.0 standard, which is why we delayed implementation of the contract, because otherwise we would be procuring something that would be to the lesser standard of 1.0, and they're going through the certification process at the EAC, and we expect more vendors and a robust marketplace by the time we start entering into our process. But doing it now would be premature, which is why we made the delay in the implementation of it for the 2028 election. one of the things about making sure that we have to mitigate the impacts of these two major projects at the same time on staff. One is that, yes, both are very urgent for us and moving forward. And we are trying to mitigate that with additional supplemental staffing needs through hiring contracts or additional PINs possibly to help alleviate the current burdens on the staff. And then I think one of the things they also mentioned about is an update on the new MD Chris project here. I'm happy to report we have a new vendor that's now on board, and we're beginning the transition to a new updated campaign finance reporting system. It should be up and running by the end of this year so that in 2026 you'll be able to file in the new system. We're going to have a robust outreach program and training as well through the parties, for treasurers, through interested parties as well throughout towards the fall and winter this year. So that's kind of the new goal there. But it has been onboarded and the contract is ready for transition into the new system as we speak. One of the last ones too was about considering the delay in implementing a new voter registration system, the modernization project. I just want to mention that I disagree with that. The one thing about elections that you all know is that our deadlines are set in stone. Elections day come. One of the other things that is going to be coming down, something that you might not be thinking about, but is of course redistricting. And the current system is over 20 years old. Redistricting is a manual process. We want to help streamline it. We want to get it ready for the next redistricting area there. But anytime you have a major project of, involving 24 local boards of election, the state board, over, 4-point-something million records, this is not something that we can do an IT project in 6 months. I want to make sure that we do this right and we expand the time. This is something where we want to make sure it's tested. It is a system that is used every day by the local boards of election, updating registrations, party changes, affiliations, name changes. So it is vital that they have buy-in and they understand it. And the longer we have for the process, the better off we are for when we go live on that. So delaying that would be a mistake in my mind, and that we need to make sure that we keep that moving forward. The local boards understand, and the staff also at SBE understands the strain that comes on with it having 3 basically major IT projects going on at one time. But this is the reality of the situation. And like everything else with elections is that we always rise to our mission and we accomplish our goals. With that, I submit for any questions and welcome the chance to present. Thank you, Chair.
Thank you, colleagues. Any questions? Delegate McComas.
I apologize. I had to go to two bill hearings in judiciary. But my question to you is, we have the National Council of State Legislatures, and I'm sure you have a national organization dealing with elections.
Yes.
And I guess what I'm kind of interested in is I was raised in a very small state, which only has 500,000 people, and we have more probably county election boards than the state of Maryland. Because we only had, so it's kind of like we got more land than we got people. But my question is what are some of the bigger states, let's say, like Florida, or let's say Illinois, or even California, how do they deal with it? Because what I'm wondering is that constantly changing with the technology, and I mean, they have to go through redistricting too. We only have 24 counties that have to be, well, more than that, I guess, 47, and then, right. But the point is, we have a smaller group than, let's say, New Hampshire, which I think has like 400 representatives or something in the lower house. So I guess what I'm kind of wondering is it really take that long to do it, and is it that expensive? Because we have, we're a small state, and we only have 24 jurisdictions. So I was just wondering if there's a way to kind of be able to economize on how the bigger jurisdictions deal with it, and we're able to deal with, massive data and massive, voters compared to Maryland.
So I guess the first part is, one, right now, our system is 20 years old, right? So that's one of the reasons why the technology has changed dramatically. Eliminating the manual entry process helps cut down on a lot of errors, right? Because the General Assembly gives us a plan, then the counties give us a plan, and then they have to put map on top of map, and then they enter it all in, and mistakes can occur, just human error. So one of the things is that's why I want to update and modernize this project here so that we can just import seamlessly those maps and the GP, what is it? GIS. GIS. I always get confused. Thank you. Into it. A lot of the election administrations in other states, Maryland is unique in a sense that we are a top-centric and then downstate. Those states that you mentioned, like California, Florida, and other states are bottom-up, and the state actually is just much, much smaller, but all the counties kind of buy their own equipment. They run their elections. They have more of their lists, and they kind of share it just periodically up with the state to meet the Help America Vote Act requirements, but it's still a very decentralized election administration portion of things.
Have we ever thought about I'm just asking because I don't know.
So I would.
Is it advantageous for us to decentralize or to stay centralized?
I would say centralized. And I think that one of the things I've always talked to my counterparts and also with the EAC commissioners, they find that the Maryland model is the best model. You have uniformity, consistency across the board, especially with policies. You don't have any variation. A person up in Allegheny County or on the Eastern Shore or in Baltimore City, you have the exact same rights and knowing methods and how it will be counted. There is no variation in our state here. And I think that policy and that is the better way of governing election administrations, and it builds more confidence and trust in the system. And right now, trust is probably the most important thing that we need to do. Which, by the way, tag me on social media because I'm a trusted source of information. I could always use more followers.
One more bite at the apple.
One more bite at the apple. There are some folks that have been very concerned that we might have problems with our election system, but I assume that there's no smoking guns in the system. And you guys have been examined numerous times by the public as well as your internal auditors.
We do logic and accuracy testing of all our equipment beforehand that is public. We have a very strong, I would say, stakeholders that are always there. They're always in our board meetings. They're at the local level. So yes, that's just one of the parts about being open and transparent. And I'm always willing to meet with individuals to explain all our security measures. The only thing I always ask about when I meet with any group is that they have to be willing to hear what I'm saying, not necessarily just berate me. But outside of that, I'm fine to meet and talk with anybody.
Okay, thank you very much. Thank you, Mr. Chair, for indulging me.
No problem. I mean, I imagine in a state like Maryland, diverse, having 24 jurisdictions, procuring different systems, testing them, managing it would actually lead itself more towards risk than what we currently have.
Yes.
I guess that's isn't that so?
Yes.
Type of question. I wanted to return to, I think, this tablet helps me here, the pretrial voting. Pretrial facility voting.
Yes.
If you could elaborate a little bit more there on how that's going.
I think it went very well. I actually visited a correctional facility and did voter registration drives myself while I was at the correctional facility in Anne Arundel County. I found it very moving. I helped register a woman who was 54 years old for the first time because she was convicted of a felony and was now serving a misdemeanor. and thought that she would never be able to vote, and I had to explain all the disinformation to her, and we helped register her to vote right then and there, and she was going to be released and vote. So it was I saw the impact of that. We have drop boxes, and we work closely with the correctional facilities to give them materials to distribute to all eligible voters, and to the equipment. We also do specific videos to release and information into the correctional facilities as well for that targeted audience, because it's a little bit unique in a sense. Yep. And it's a lot of disinformation, and just making sure that that they understand that past felony convictions does not preclude you from voting in current elections. Yep. So it's one of the things that I've highlighted and tried to work with the advocates in that situation there. With affecting a historically disenfranchised population.
I appreciate your response there, and I also wanted on the record, because I do get messages from people who are watching from home, and I want on the record that folks know in Maryland, even if you are incarcerated, you still retain your ability to vote, and that's something that makes Maryland unique. That is not everywhere in this country, and I'm glad we were able to move forward that with bipartisan support in years past. But you can do that. A couple other questions. When it came to marketing that the elections were coming and the various vehicles to vote, I saw the data on social media and whatnot. For more traditional media, did we use some diverse outlets as well to get the word out?
Yes, especially in the radio. We use those traditional sources, urban radio stations, targeting more minority voters. Yep. In that sense there. TV ads are a little bit more expensive. Yeah. So I made more of the cost-benefit analysis was I'd rather do a little bit more targeting.
More strategic with the radio.
Yeah, but radio was definitely a medium that we used, and did a bunch of ads on as well.
You spoke a little bit to the federal funds as well too, and I just want to know if you could, obviously there's a lot going on there as we in appropriations are trying to address our unique challenges ahead of us right now. We're also following that. Can you speak at all to within your lane and some of the pass-through federal funds that help us, if there's anything else you could elaborate, things you're watching, things you may be concerned of that would be important for us to know?
I guess right now, one of the interesting things was that we received all our federal funds up front. So,
so we're good for now.
Exactly. Right.
I guess I should ask: is it in the account or is it on its way?
Oh no, it's in the account, right?
Okay.
It's in. We got it. So they can't take that back. We might move accounts so that they can't withdraw. But yeah, it's something that right now that we are monitoring. They haven't really attacked the EAC as much or stopped any of those fundings. But it is something that we are monitoring and going forward with it. There is an impact with the fact that CISA, which is the Cyber Information Security Agency, they are no longer doing election support, and they were very much a part of our cybersecurity defense mechanisms there. But one of the things is that recently we have hired a CISO in-house. That's great. So that's been great to have that. But we're going to probably look for more. We have to look at creative ways for our cybersecurity because we've lost a key federal partner on that front going into the 2026 election.
With adjusting back to in-person voting, were there any challenges unique? Obviously, 2020, 2022, a lot of people were doing mail-in vote. We've seen that continue to increase, particularly in the primaries, as you're saying, but in the general, in-person voting is still the preferred method. I guess when we made that switch, did we notice any challenges to in-person?
The interesting part, I should say. Yeah, the interesting part on the general, and you can see on that chart there that DLS did, it was the breakdown wasn't overwhelmingly heavy in the general election to in-person election day voting. It pretty much was, a majority of it was, on in-person voting, but we had 1.2 million vote in person on election day, a little bit under 1 million vote in early voting, and 800,000 a vote by mail. So it's breaking down pretty much evenly across the board there. So the impact of it now for election administration was we've been trying to figure out the new normal. One of the most challenging parts is making sure on election day enough results are released, because a lot of people still, the perception is to still declare winners and losers on election day. And that is very much dependent on when mail-in ballots come in from the voters. This election, they came in earlier, but if they come in later, there could be delays, and we're going to start managing those expectations with it. But right now, on the general election, we were able to run almost 3 different types of elections simultaneously, and being able to manage the resources and the election judges accordingly. But I think that might be the new trend here as to the 3, which is not the greatest, but it does help on election day that it's not, a
surge that people are, waiting as much. Well, thank you so much, colleagues. Do you all have any further questions for the administrator? Seeing none,
No,
y'all have
thank
a
you.
fantastic day. It's good to see you. Okay, so now we will move along to State Archives. Elizabeth, you can begin when you are ready. And I believe I saw Miss Elaine is here. Yep. And then you will approach when she's there.
All right, thank you. I have the fiscal 2026 budget analysis for the State Archives. The allowance is $11 million, which is an increase of $3.4 million from fiscal 25. That's due mainly to an expected $3 million general fund reversion in fiscal 2025. As you'll see on page 1, the fiscal 2026 allowance is almost entirely in special funds. This is because the agency is implementing a new fee structure for its land records website, which I'll talk about in a moment. The overview of spending is in Exhibit 1 on page 2. 74% of the allowance goes to regular personnel expenses, and 11% supports the rental and costs for off-site warehouse space to hold some of the agency's collections. The proposed budget change chart is shown in Exhibit 2 on page 3. The largest change, as I mentioned, is due to an expected $3 million reversion in fiscal 2025. And then personnel costs make up most of the rest of the change. The fiscal 2026 allowance includes 2 contractual conversions to regular positions and a total reduction of 3 contractual FTE positions. The agency has the equivalent of 4 vacant regular positions, which includes 2 half-time positions that the agency is in the process of combining into 1 full-time position, which will probably be easier to hire for. And DLS has asked the agency to provide an update on its efforts to fill the vacancies. Moving to key observations on page 5, I'll start with the new fee schedule that I mentioned. The State Archives maintains an online database of property documents such as deeds and mortgages from all around the state. And the site currently offers free downloads for individuals and a subscription option for companies that need to download large numbers of records in bulk. However, in recent years, some companies have started using bots to create multiple individual accounts to download records, circumventing the subscription fees while putting a strain on the site's servers. This is in violation of the site's user agreement and also increases operational costs without generating any revenue for the agency. However, by the end of fiscal 2025, the State Archives is planning to implement a 20-cent per page fee schedule for downloading records. This is similar to the PSA system that the federal courts use and similar to systems that are used in some of the surrounding jurisdictions. And the agency projects that even after accounting for a potential decrease in downloads once the paywall goes up, the new fee schedule could bring in $1 million in revenue per month, Hence the transition you saw on the first page to a budget that is almost entirely in special funds for fiscal 2026. The new fee schedule is also expected to bring in enough revenue in fiscal 25 for the agency to make a planned reversion of $3 million. And DLS has asked the agency to provide an update on plans for the new fee schedule and when it is expected to be implemented. Key observation 2 begins on the age of page 5. There were increases in the number of public programs and in the amount of materials provided to patrons in fiscal 2024 compared to the prior year. Exhibit 3 on page 6 shows that the archives offered 154 public programs in fiscal 2024. Many of these are saved to YouTube for people to view. As of fiscal 2024, the agency holds more than 416,000 cubic feet of materials in its physical collection and more than 190,000 gigabytes of electronic records. And Exhibit 4 on page 7 shows the amount of material provided to patrons online, in person, by mail, or by phone. And DLS recommendation is to concur with the governor's allowance that is shown on page 8. That concludes my analysis, and I can take any questions.
Thank you. Colleagues, any questions? Seeing none, you all can approach. Begin when you're ready.
Chair Lewis and members, I'm Elaine Rice-Bachman, State Archivist. With me today are Assistant State Archivists Corey Lewis and Emily Olin Squires, along with Director of Administration Teresa Fawley. We extend our thanks to Elizabeth Wabel, DLS analyst, who is new to our agency this year and who took the time to meet with us and view our operations in person. As we like to say, although the Archives is a small agency, we have a very wide portfolio of responsibilities across state government. Ms. Wabel listened to our concerns and thoughtfully responded to them in her analysis. And that analysis reflects the considerable budget challenge we faced in FY24, when an unanticipated drop in special funds occurring in the middle of the fiscal year caused us to plunge into a fiscal crisis. And here I want to acknowledge and thank the Deputy Director of Administration, our accountant, John Tillon. Through his and Teresa's careful guidance, our staff navigated a period of near zero extra expenditure, employing a must-have-only policy with managers for any supplies or services and deferring any maintenance on equipment or software that was not absolutely essential to our operations internally, and without sacrificing any of our public services. This belt tightening enabled us to get through the fiscal year without exceeding our appropriation and challenge us to reevaluate our existing fee schedule for land records and create a sustainable revenue source for the future. Knowing that general funds would not be available to restore our budget in FY26, the Archives endeavored to find a way to restore the loss of special funds by analyzing closely the public users of mdlandrack.net, the online access to recent and historical land record filings and indices from Maryland circuit courts, which we maintain. In doing so, we identified that the top 50 users of the site are for-profit businesses, with multiple, in some cases hundreds, of individual users under each business creating individual accounts. We calculated potential revenue derived from moving from the current fee schedule based on bulk user subscriptions to individual user fees. In considering this move to a paywall for certain users, we also analyzed our neighboring states to see if land records were being monetized. What we found is that the counties in each neighboring state charge an average of $1 per page, and that Maryland is the only state that provides a single location for land records, as well as the only state that did not charge users for downloads or copies. With approval from the Office of the Governor, the Department of Budget and Management, as well as the Department of Information Services, we are currently engaged in the process of developing a paywall of 20 cents per page for MarylandLandRec.net to be implemented in the fourth quarter of FY25. The revenue we anticipate receiving will restore and exceed the previous amount of special funds, allowing us to reduce our reliance on general funds. Historical land records, those over 100 years old, will remain free to the public, and access in the courts, as well as free access in the Maryland State Archives search room, will remain the same. We have more thoroughly described these plans and responded to the other questions posed in Ms. Wable's analysis in my written testimony. I and my colleagues here are prepared to answer any questions you may have today. In closing, I will echo the Council of State Archivists in stating that effectively functioning government archives are the foundation of open and transparent government operations that meet constituents' needs. The Maryland State Archives' mission to preserve and make accessible the permanent records of state government and Maryland history provides essential service to the public. On behalf of our entire agency, I want to thank the Maryland Legislature and the Office of the Governor for supporting that mission and facilitating our existence as an independent agency under the Executive Department. Thank you very much.
Colleagues, any questions? Okay, I have one, which is that I think it is a very novel and innovative approach, especially given our fiscal challenges, to move to the paywall and the fee structure. And given that a number of our neighboring jurisdictions are at $1 per page to start off at 20 cents, I think that's much more reasonable. I just wanted to know, has there, for, let's say, those top 50 folks who, entities, companies, what have you, that are pulling information, has there been any communication so that they anticipate the change going? I assume so, but I just wanted to make sure.
Absolutely. I'll let Corey speak to that.
Sure. So yes, we have been in contact with the title community, certainly during the unstable period that Elaine referenced. One, to kind of track and understand more clearly how the site is being used, so we could effectively determine what is bot activity and what is just simple user activity. We have not released plans yet, and I guess this will be the form that kind of people are learning that we are moving towards this paywall. We're seeking permission, governor's office, as well as OSP, and the challenges of how we would procure a new system, whether it's internally or seeking a vendor. So we were hoping to release notice to the public within 30 days prior to going live to communicate that we would be charging this nominal fee.
And do you guys have a general, I know you said 30 days, general timeline, for the year for, I guess, reaching these milestones?
In terms of
initiating the paywall, letting people know when the paywall will go into effect, and then it going into effect.
Yeah, so we're looking at the fourth quarter of this fiscal year. Again, with any sort of development, especially with this sort of platform on this scale, we cannot guarantee that 30 days, so we want to be careful, take a measured approach, but certainly we are hoping to get this out to the public in a matter of weeks, the communication that we will be implementing this paywall.
That's great. We love things that alleviate the stress on our general fund. Colleagues, Delegate McComas.
Thank you, Mr. Chair. I'll be brief. I know that if I want to get records from the land records for Harford County, I go down to the courthouse and I pay maybe $1 or 50 cents. I can't remember the last time I did it. But the question is, with you implementing this system statewide, so I could get records from any of the counties, is this going to impact the circuit courts and their land records? Because they get money for me going in and saying, hey, I need, a copy of this deed or this mortgage or whatever. So that's my thought, because I could see the clerks coming in here and having a nervous breakdown because they're going to lose some money. So just if you could comment on that.
We don't anticipate any change to courts' access, and we have been transparent with the Administrative Office of the Courts of this plan as well. So we are, like the public, we will have notification when this is happening, but it is the understanding that we will not change at all the way the land records are accessed in the district courts.
But in other words, this will be good for the big companies. This would be, in other words, the companies that are in the land records business, with whether it be the banks or the mortgage companies or the real estate folks, they're the ones that are going to be interested in going with your system, I would suspect, the big players.
I was just going to say the system already exists. So from your home now, you can get land records from all across Maryland for free. You don't have to go to the circuit courts. You can, and some people choose to. So the system is already implemented. What we're doing is now making it for records that are modern, so records that are less than 100 years old, there would be a 20-cent per page fee to download it. Right now, you can download it and there's no fee. So we're not inventing a new system. It is just putting a paywall on a portion of the system. And that is the part where these companies are using the modern records for their businesses more than the individual, like family history researcher, a historical scholar, something like that, typically are using the historic records. Is that so? There shouldn't be a change to the. We're not implementing any change to the courts, and there will be no change in access either to the system at the courts or to our system. It's just that 20 cents per page download for the modern records.
A real quick follow-up. Just so I get this straight. Basically, in other words, this is within 100 days of the activity that you'll get it hot off the press, where if it's older. What I'm saying is older.
So we.
You just download it for free. Still.
So the entire. Sorry. So the entire platform is free for all users, regardless of the historic. When we're talking about the modern records, we actually receive daily downloads from these counties. We receive the data the night before and then the imagery the following morning. Our staff processes and makes them available. So it's normally next day.
Mm-hmm. So in other words, this is really for people that are doing land and development, all that kind of stuff, and they want to know what's going on.
Right, and for mortgages and stuff. Excuse me. Thank you. Thank you.
No problem. Any further questions, Archivist? Seeing none, thank you guys so much.
Thank you.
All right. Last but definitely not least, we are going to move to the Governor's Office of Crime, Prevention, and Policy. So Ms. Miller, you can begin your analysis, and then Ms. Lenig, you could approach. We do have a number of witnesses, so after the Executive Director speaks, then we will move to the other testimony. Thank you.
Good afternoon, Chair Lewis and committee. My name is Madeline Miller, and today I'll be presenting the DLS budget analysis for the Governor's Office of Crime Prevention and Policy, or GOCPP, or GOCAP. Between fiscal 25 and 26, the agency's budget decreases by $7.8 million to $331.1 million. As will be discussed later, BRFA actions and contingent language in the operating budget reduce the agency's spending by $11.8 million. Excluding the impact of these provisions, the budget would increase by $3.9 million, largely due to personnel actions. The performance analysis portion of the document begins on page 4. This section highlights both the agency's administrative functions as a grants administrator and select crime measures due to its role as the primary agency for public safety resources in the state. The agency also publishes the state's crime plan. Though an annual update was published in December 2024, the agency's strategy for the next 3 years remains in progress. With the most recent submission of Managing for Results data, GOCPP reorganized its key goals, objectives, and performance measures, including those classified as outcome measures and related to crime statistics. Exhibit 1 on page 5 shows 3 measures that the agency used to report: the number of homicide victims, the number of juvenile victims of homicide, and the number of non-fatal shooting victims. The agency also used to report the relative rate index of racial and ethnic disparities in the juvenile justice system. None of these measures were reported in this year's data. In an evaluation of the agency by the Office of Program Evaluation and Government Accountability, or OPEGA, back from January 2022, OPEGA recommended that the agency consider modifying its MFR performance measures to provide more context and insight into efficiency and effectiveness. A specific suggestion also included measuring outcomes using more crime categories than was reported at the time. Only one outcome measure was reported in the fiscal 26 submission: the number of criminal networks disrupted or dismantled through Maryland Criminal Intelligence Network sites funded by GOCPP. Previously, the same measures were classified as an output rather than an agency outcome. This data is presented in Exhibit 2 on page 6. In fiscal 2024, 369 networks were disrupted or dismantled, a 47% decrease compared to fiscal 23, but 13.5% higher than in fiscal 2020. In its testimony today, GOCPP should comment on its MFR reorganization and its exclusion of measures specific to the agency's impact on preventing crime and reducing recidivism in Maryland. The agency reported additional measures related to efficiency and grants status in its MFR, however. There were over 1,100 subgrants in fiscal 2024, approximately 200 more than in fiscal 2020. Though the agency will have additional grant monitors in fiscal 25, the ratio of grants per grant monitor was impacted by the increase in subgrants. Also, due to an updated methodology for counting the number of grants monitors, the ratio of grants per grant monitor rose to 149 to 1, as shown in Exhibit 3 on page 7. With a subaward to monitors ratio of 149 to 1, the average time between the application due dates and the notification of awards for all fiscal 24 subawards, excluding those for SAP, which have a different grant process, was 87 days. DLS estimates that if there continue to be 1,115 subgrants in fiscal 2025, and there are 15 filled monitor positions, that the ratio of grants to monitors will be approximately 74 to 1, but the agency's goal is 50 to 1. Turning now to page 8, one of the agency's objectives is to expand and diversify its grant applicants and subrecipients, as shown in Exhibit 4 on in the middle of page 8. The number of distinct entities that applied for funding, the number of first-time applicants to GOCPP grant programs, the number of distinct entities that received awards, and the number of entities that received funds from the agency for the first time all rose between fiscal 23 and 24. The second MFR indicator discussed is the number of Criminal Injuries Compensation Board and Sexual Assault Reimbursement Unit claims. GOCPP provides direct services through its Victim Services Unit. CICB within VSU is the entity responsible for administering the state's general compensation program for victims of crime, persons who have made efforts to prevent crime, and dependent survivors of those individuals. The VSU also operates SARU, which deals with claims relating to sexual assault forensic evidence examinations. Chapter 705 of 2024 significantly alters numerous aspects of CICB operations. This impact is not immediate, as most of the provisions take effect on July 1 of this year. The Act and the CICF are discussed further in Issue 2 of this analysis, but in anticipation of these changes, the agency also reorganized its MFR measures. Exhibit 5 provides information on CICB claims in fiscal 24 and compares the figures with those submitted in the Criminal Injuries Compensation Board fiscal 24 annual report. New efficiency measures include average days of claim processing time and the percentage processed in 30 and 90 days. GOCPP should comment on the differences in these reported figures and how information about CICB claims will be tracked in the future. In the fiscal 26 MFR submission, the agency also expanded the data that it reports about SARU. The agency will report the claim processing time for SARU beginning with the fiscal 27 submission as well. SARU received 3,354 claims in fiscal 24 and processed 4,991, as shown in Exhibit 6 on page 10. The number of claims processed by SARU was variable in the fiscal 2020 to 2024 period. Between fiscal 23 and 24, the number of claims processed grew by 113%. The combined number of claims processed under CICB and SARU was reported in the MFR data. Comparing the previously reported number with the new combined measure indicates that between fiscal 23 and 24, the number of claims processed under these two units or programs increased by approximately 74%, from 3,244 to 5,638. The third piece of performance analysis appears on page 11. As part of its objective to provide resources to reduce sexual assault evidence kit backlogs, the agency expenditures include the National Sexual Assault Kit Initiative and Sexual Assault Kit Testing Programs. The former is funded with federal funds, and the latter is supported with special funds from the Rape Kit Testing Grant Fund. GOCPP began reporting the number of kits tested through these programs in its newest MFR submission. Across the period shown in Exhibit 7, the average number of kits tested per year was 408. Funding associated with the sexual assault kit testing program is discussed further in the fiscal 25 and BRFA sections of this analysis. I'll now turn to a discussion of the agency's budget. Fiscal 2024 closeout information is discussed at the top of page 12 in Appendix 3. In closeout, the agency reverted $3.4 million in general funds and returned $1.1 million to the federal government. The fiscal 25 working appropriation included approximately $10 million in general funds for the agency to make 11 grants to various recipients as part of an implementation of legislative priorities from Section 21 of the fiscal 2025 budget bill. The list of these grants is provided on pages 12 and 13. Of the approximately $10 million, $4 million was reduced through cost containment actions taken by the Board of Public Works in July. GOCPP reports no problems with awarding funds for most of these grants. Funding for the state's attorney's office case management systems has not yet been awarded, as the application deadline was set for February 2025. Additionally, $25,000 for the Olney Police Satellite Station has also not been awarded, as the agency is awaiting a response from the Olney Chamber of Commerce. Section 21 also authorized the addition of $1 million in performance incentive grant fund special funds to the statewide expenses program within DBM for the purpose of transferring funds to the Office of the Correctional Ombudsman, contingent on enactment of legislation establishing OCO as an independent unit of state government and expanding the allowable uses of the fund. Most of the funding made available through these legislative additions is not continued in the allowance. However, the allowance does reflect higher planned expenditures for the Sexual Assault Rape Crisis Grant Program due to the inclusion of this spending in the funding formula for fiscal 26. The allowance also includes $250,000 for the Maryland Entertainment District Security Program, which was established by Chapters 746 and 747. The fiscal 26 allowance includes a general fund appropriation, but no special fund expenditure, and a special fund is allowed under the grant or under the legislation. GOCPP should comment on whether it intends to establish a special fund account for this program in fiscal 26. 3 cost containment actions reduced the agency's spending by approximately $5.3 million. 1 action reduced funding for 7 positions, and the agency reports that it has been required to hold these 7 positions vacant during fiscal 25. A 2nd action reduced funding for the warrants and absconding grant program from the mandated level of $2 million to $1 million. The 3rd reduced the funding available for the police accountability grant by 50% from $8 million to $4 million. $4 million of that $8 million was added by legislative priority spending. The fiscal 26 allowance also includes 10 proposed deficiencies that add a net of $6.4 million to the appropriation. Areas of increase include $4.4 million for fiscal 24 VOCA assistant grants, which are paid in fiscal 25, $1.7 million for statewide operations of the Regional Navigators Program, $1.2 million to support higher contract costs within SARU, $1.1 million to support compensation paid by CICB, approximately $700,000 in family violence prevention and services funding to reflect the availability of additional funds, $500,000 to support the cost of administering the Juvenile Justice Match Program, funding from the PIGF Special Fund to account for an additional award, which was $136,624 in fiscal 25, and finally, funding for from a position transferred from the Department of Juvenile Services with funding prorated for half of the fiscal year. These increases are partially offset by reductions of $1.7 million to the rape kit testing grant fund and the same amount from the special fund appropriation to be in line with planned grant awards in the current year. I'll now turn to the allowance. In fiscal 26, the agency will have a budget of $331.1 million. This funding is broken out by program in Exhibit 8 on page 16. The administrative headquarters and local law enforcement grant budget programs make up the largest cost categories at 34.1% and 56.4% respectively. Other programs include the Victim Services Unit, MSIN, the Baltimore City Crime Prevention Initiative, the Violence Intervention and Prevention Program, and the Maryland Statistical Analysis Center. The change in the allowance is detailed in Exhibit 9 on pages 18 and 19. The allowance includes $315 million in planned grant expenditures, including 31.3 million in funds which are double counted due to all of the agency's non-lapsing special fund accounts. Budget changes associated with the grant programming account for a net decrease of 10.1 million between fiscal 25 and 26. Additional detail about the changes to state grants and federal grants can be found in Appendix 4 and 5. A grant program that increases between fiscal years is the Protecting Against Hate Crimes Grant. PAHC funds may be used by nonprofit or faith-based organizations to procure security personnel and equipment to provide physical security of buildings or facilities. The working appropriation includes $5 million for the grant fund and a corresponding $5 million in special fund authorization. The general and special funds available for this grant program grow in the allowance to $10 million each. As introduced, 5 provisions in the BRFA are related to grant expenditures and its special fund accounts. One provision would alter a mandate related to the VOCA Assistance Grant Program. Additional discussion of this provision, VOCA funds, and the grant program can be found in Issue 3. Another provision would reduce the mandate for warrants and absconding grants in fiscal 25 and 26 to $1 million instead of the $2 million required by Chapter 174 mentioned previously. A third provision would expand the use of the PIGF to allow $1 million in special funds to be used to support the operations of OCO. This continues an action taken by legislative priority spending and Chapter 836 of 2024. The fourth provision authorizes the transfer of $4.9 million from the Maryland Violence Intervention and Prevention Program Fund to the general fund. This action is designed to reduce the special funds balance. It would not impact the agency's planned expenditures, but could limit the amount of funding available for grants of this type in future fiscal years. Similarly, a provision transfers $4 million from the Rape Kit Testing Grant Fund to the general fund. This, in combination with the mentioned fiscal 25 deficiencies, would reduce the general and special fund authorizations. Is designed to reduce the special fund balance to approximately zero. This could also limit the amount of funding available for grants in future fiscal years. The agency's grant expenditure continues funding in fiscal 26 that was only planned through fiscal 25. GOCPP's largest grant is the State Aid for Police Protection Program. This grant was expanded in fiscal 23 in connection to an initiative that was expected to increase funding for law enforcement, crime prevention, and victim protection services by over $500 million through fiscal 2025. Funding under the original formula and the enhancement is provided in Exhibit 10 on pages 21 and 22. The enhancement amount was set at $45,878,143 in fiscal 2023. That figure was calculated based off of a modification of the base formula. During the 2022 session, SB 397 and HB 411 were introduced and would have provided the following additional funding through SAP: $975 per sworn officer in the recipient agency, $6.46 per jurisdictional resident, and an $8 million grant to Baltimore City. The increased funding would have been permanent. However, this legislation was not passed. Rather than allocate the funding in this manner, it has been allocated according to violent crime rate data published in the state's Uniform Crime Report. This funding is not mandated and was not planned for fiscal 26 as part of the initiative. DLS recommends deleting the funding for the SAP enhancement. Another component of the enhanced public safety grant funding through the agency that was planned for fiscal 23 through 25 was the Police Accountability Grant, also known as the Police Accountability Community and Transparency Grant. The funds were intended to ensure local law enforcement agencies would be in compliance with Chapter 59 of 2021 by the start of fiscal 24. Cost containment actions previously reduced this funding from $8 million to $4 million in the working appropriation. The allowance includes $4 million for the grant. DLS recommends deleting the $4 million appropriation for the Police Accountability Grant funding. Finally, I'd like to mention that the allowance as introduced does not provide the mandated level of funding for the Maryland Behavioral Health and Public Safety Center of Excellence, though expenditure on this program does increase between fiscal years. GOCPP reports it will work with DBM to ensure the mandate is met in full. Personnel data for the agency is presented on pages 23 and 24. Between actual year and the working appropriation, the agency gained 20 new regular positions, all of which were added to the administrative headquarters program. Last session, GOCPP reported it was determining the best use of the staffing and may choose to allocate the new positions to support its other programs. 7 of the new positions are held vacant due to cost containment actions taken by the Board of Public Works at its July 24th meeting. The agency reports that it will begin hiring for the 7 positions in fiscal 26. The next couple of sentences will require a technical correction. Excluding 7 held vacancies, the agency has 7 vacant positions and a vacancy rate of 8.97%, not 7.69. Of those 7 vacancies, 1 has been vacant since December 23, 2 have been vacant since December 2024, and 4 have not yet been filled. In fiscal 26, the agency receives 21 additional regular positions, of which 18 are contractual conversions. Correspondingly, there's a net decrease of 17.2 contractual full-time equivalents. Given that most of the positions that the agency gains in fiscal 26 are contractual, the agency's turnover rate decreasing from 13.4 in fiscal 25 to approximately 5.4%, and the allowance is appropriate. The agency's 3 new positions are added to the Victim Services Unit, and the agency reports they will include 1 lead fiscal accounts clerk and 2 administrative specialist positions. Due to the availability of vacant positions, DLS recommends that the general fund allowance be reduced and that the 3 new regular positions within VSU be deleted. The issues section begins on page 25 with a discussion of how the agency has responded to 2 recent audits: a grants management processes audit that was completed in fiscal 24 and a fiscal compliance audit by the Office of Legislative Audits that was published in June 2024 and covered the period of November 18th, 2018 to January 31st, 2023. As a result of the former, the agency planned to update its subrecipient monitoring methodology and track additional grant activity and reports within its grant management system. As a result of the latter, the agency also fulfilled recommendations related to grantee and subrecipient data. OLA's first finding was that the agency, which was formerly known as GOCPYVS and known as GOCPYVS during the time of the audit, did not obtain documentation to support expenditures and performance data reported by grantees and did not have a comprehensive plan to audit grantees to ensure that grant funds were used as intended. During the audited period, approximately 3,500 grants were awarded, but only 14 audits were completed, and 7 of those identified unallowable expenditures. To address the finding, OLA recommended that the agency establish a policy to require grantee reporting of supporting documentation, to enable it to verify grantee data on a test basis, to create a formal grantee audit policy, and to take appropriate action to recover any grant payments that are determined to be unsupported. The agency required until September 30th, 2024 to implement the first 2 recommendations, but did meet this deadline. Information about the number of audits the agency performed was previously included in the agency's MFR submission, and data should be available for fiscal 25, as the agency did resume desk audits and site visits in the working appropriate or in the current year. The agency should comment on whether it plans to include the following MFR measures in its fiscal 27 submission: the ratio of grants to monitors, the percentage of grants and risk status audited, the percentage of total grants receiving site visits, and the total number of audits completed. The agency's improvements are not yet reflected in all of its performance data. One measure that indicates the agency's ability to award funding at the appropriate level and support its subrecipients is the percentage of unused general and federal funds returned by subrecipients. As shown in Exhibit 11 on page 26, subrecipients returned 9.9% of federal and 4.6% of general funds that GOC provided in fiscal 24, compared with 4% and 4.3% in fiscal 23. In its audit, OLA also found that the agency improperly reverted general funds at the end of 2 fiscal years, resulting in the need for subsequent deficiency appropriations. In the most recent closeout, the agency reverted $3.4 million in general funds and returned approximately $1.1 million to the federal government. A fiscal 25 deficiency is also required to fund $4.4 million in fiscal 24 VOCA assistance grants, which were paid in fiscal 25. The reverted general funds could have been encumbered to offset those costs. GOCPP should comment on its history of insufficient encumbrances of funding obligations, identify the federal funds that were returned in closeout, and discuss the actions that will be taken to prevent this occurring in the next closeout. Issue 2 begins on page 28. The agency is currently preparing to implement Chapter 705, which is expected to increase awards paid by the Criminal Injuries Compensation Board to eligible victims. Due to the shorter processing times that the law requires, the allowance includes 3 positions to support the expected workload. The agency is also upgrading the database that supports the CICB, making changes to the claims process, and creating an electronic application. Not all fiscal impacts can be reliably forecasted. The special fund that supports CICB revenues and the federal revenues, which may also be used to pay claims, will likely not make enough funding available for the state to pay the higher level of claims anticipated in fiscal 26. General fund support has already been provided for fiscal 24, 25, and 26, as shown in Exhibit 12 on page 29. Note that special fund expenditures on claims were negative in fiscal 25 in the balance sheet shown on Exhibit 12, or shown in Exhibit 12. They're shown as negative in fiscal 24 due to the agency reclassifying these expenses as federal expenditure. Federal revenue used to support the CICB includes VOCA compensation funds. The annual award is calculated as a percentage of the amount of compensation paid to claimants during the federal fiscal year 2 years prior to the present federal fiscal year. The percentage is currently set at 75%. In the 10 most recent award cycles, the state has received between $1.1 million and $1.8 million, as shown in Exhibit 13 on page 30. While a higher certified payout for the state will lead to higher federal awards in the future, the funding available in state fiscal 26 will not be impacted yet. Another way the federal award could increase is if federal regulations change to make additional state expenditure from SARU eligible for the certified payout amount. A proposed rule from February 2024 may have impacted the state's payout calculation. The agency should comment on whether it has received any updated guidance on SARU expenditures and the federal VOCA compensation received by the state. The agency also missed the opportunity to spend some of its federal awards. As shown in Exhibit 14, the agency failed to use its federal 2019 award in the time it was available to the state. Instead, the funds were canceled in fiscal 23 closeout, which was beyond OLA's audit period. If current revenue sources cannot support potential claims, the program may require additional support from the general fund or need to pay fewer claims than are eligible. To ensure that information about the operations of CICB and budgetary concerns are promptly reported, DLS recommends withholding $100,000 in general funds pending the publication of the agency's CICB Fiscal 25 annual report by November 1st. The third issue relates to planned state spending on the VOCA assistance program. The VOCA program seeks to provide victims of crime with assistance and services to support their restoration following a violent crime and help them navigate the criminal justice process. Exhibit 15 shows the federal awards received each year from federal fiscal 2015 to 2024. Since federal fiscal 2018, annual awards to the state have declined. The federal fiscal 24 award was $14.2 million, a 42.4% decrease compared with the previous year. Though federal funds can typically be extended up to 3 years after awarded, the agency must use all of the federal fiscal 2024 award in combination with general funds to make $60 million available in fiscal 26 as required by chapters 625 and 626. Given that there's only $14.2 million in federal funding available for the fiscal 26 award, the budget would have been required to provide approximately $45.8 million in general funds, or $10.5 million more than was required in fiscal 2025. A provision in the BRFA changes the mandates of the agency would provide $35 million in general funds only. Language in the budget bill reduces general fund appropriations by that $10.8 million amount to $35 million in fiscal 26, contingent upon enactment of the provision. If the mandate is changed, the total amount of VOCA funding available in fiscal 26 would be $49.2 million, a 17.9% decrease compared with the level provided in the current year. As VOCA funding and expenditures remain of great importance, the DLS recommends adding budget language restricting funds pending the submission of an annual report about past expenditures and outcomes, as well as the planned fiscal 26 grants to be due on November 1st. The recommended actions are listed beginning on page 34, and the appendices appear on pages 37 through 46. That concludes my presentation. I would be happy to take any questions from the committee at this time.
I'm going to give you a second to get your breath.
I'm good.
Colleagues, any questions for DLS? Seeing none, Dorothy, you and the team can approach and begin when you are ready.
Good afternoon, Mr. Chairman, members of the subcommittee. My name is Dorothy Lenig. I'm the Executive Director of the Governor's Office of Crime Prevention and Policy, or GOCAP. Thank you for the opportunity to appear today as you consider the operating budget for GOCAP for FY26. First, I want to thank our DLS analyst, Madeline Miller, for her thoughtful and thorough analysis. I'd also like to introduce the panel with me today. We have Bethany Young, who's our Policy and Legislative Director, and Sylvia Senkist, who's our CFO. And in the audience is Quentin Jones, who is our Criminal Justice Grants Division Director. I continue to be grateful to GOCAP's management team, who are really committed to rebuilding GOCAP. A significant portion of GOCAP's work is making grant awards to law enforcement, victims, and children-serving organizations. We're committed to awarding these funds fairly, equitably, and in accordance with the governor's public safety priorities. As you know, one of the largest grants that GOCAP administers is the VOCA grant. In FY25, GOCAP released the VOCA NOFA, making it 100% competitive for the first time in 6 years. This allowed GOCAP to fund programs addressing the most critical victims' needs statewide. We provided increased funding to some organizations, and we were able to fund some new organizations. In FY25, GOCAP received a total of 147 applications requesting over $82 million, and we had $60 million in funding. In FY25, GOCAP got the VOCA awards out on time for the first time in many years. And for FY26, we've already released the VOCA NOFA, which is earlier than in previous years, and it again is 100% competitive. I've submitted my written testimony and responded to DLS's analysis, and Sylvia and I are happy to answer questions. I wanted to comment on one issue that was raised in the DLS analysis, and that's the one on page 24 that talks about cutting the 3 positions to the Victim Services Unit, or the CICB work. GOCAP strongly disagrees with this recommendation. This recommendation would delete the new PINs allocated for the Criminal Injuries Compensation Board. As described in DLS's analysis, the changes to the Criminal Injuries Compensation Board, which will begin on July 1st, will result in an increased number of people eligible to receive awards. It removes some of the disqualifying factors, and it shortens the time for us to process claims from 90 days to 30 days. So we're going to have more people who are eligible, more people who can eligible for funds, and a much shorter time to process. GOCAP needs additional staff to handle this increase in workload. The DLS analysis recommends deleting the PINs because it says that we have other vacant positions. We disagree with this assertion because all of the currently vacant PINs are designated for other purposes. Last year, GOCAP received 20 new PINs to allow us to get closer to the staff to grant ratio that other states have. Because of cost containments, we were only allowed to fill 13 positions. We've currently filled 10, with 2 additional that are in the final stages of hiring. The other 7 we had to hold. So it's not that we didn't want to fill them. We definitely wanted to fill them. We just weren't able to. The 18 PINs that are designated for contractual conversions, there's staff currently working full-time in these positions. They'll simply be converted from contractual employees to PIN positions. There's one more position that was given to GOCAP by the Department of Juvenile Services, and that was to staff the new Juvenile Justice Commission. And the one vacant PIN that's been vacant for a long time is for a Protect Coordinator. This was a legislatively created position to embed a person in the police department and then serves as a community liaison. So therefore, GOCAP currently has no vacant undesignated PIN positions to move to CICB, and therefore strongly disagrees with this recommendation. That concludes my remarks, and we're happy to answer any questions.
Thank you, Ms. Lenig. It's always good to see you and the team. Colleagues, any questions? Delegate Schindler.
Thank you, Mr. Chair. Very near and dear to me are our child advocacy centers. I previously served as a president of the board of directors for our local child advocacy center, and I'm glad to see we've come a long way with funding for those, but I think we still have a long way to go. Right now, we've got an estimated, I think, $50 a child that we serve at our child advocacy centers that the state is funding, but we're far behind our neighbors. For example, some statistics here: Virginia seems to pay about $159 per child served, Pennsylvania around $200, and Delaware all the way up to almost $700 a child. Could you possibly talk a little bit about the challenges in funding our CACs to kind of put us on par or a little closer to our neighbors when it comes to funding our child advocacy centers?
Well, one of the benefits last year of making VOCA competitive was for the past 6 years, we only funded organizations that had been funded in the past, and some of the CACs had not been funded. So by making VOCA competitive, we were able to fund some of the CACs that had not been funded in the past.
Thank you. Any further questions? Delegate McComas?
I'll tell you, my colleague got me interested in this. There's a real concern because if let's say Delaware is paying $700 and we're paying, what was it, $50 or something per child for the child advocacy per child going in, my concern is are the kids in Delaware getting a lot better services and help for the issues when they go through that child advocacy center? I mean, that's a lot of money.
If you designate more money for the CACs, we are happy to administer it.
Well, I guess what I'm concerned about is, we talk about taking care of the kids, and the kids that have to go through a child advocacy center, it's serious. There's a serious problem. And you got to figure out where the bugs are. And I guess my concern is that, in other words, they're not really a priority here compared to other states. That's all I'm saying. And I mean, that's kind of what I'm seeing here. And it's not your fault. It's just, it's Maryland. So I guess I'd just kind of like to know what type of service you guys are able to do versus what these other CACs are able to do, in other states that have more money. And is it the fact that we have less or more need for the child advocacy versus them, or they have less and so they can do more?
So the child advocacy centers are a vital part of our community, and they do really important work. We are happy to administer any amount of money the state wants to give us to administer, and we also encourage them to apply for what they need through VOCA so that we can compare them to the other needs in the state and hopefully fund them to meet their needs.
Just a quick follow-up, Mr. Chair. I guess my concern is, I know, in the last election in my county, there was a real issue of whether the state's attorney at the time that was running for re-election was really, let's say, involved in the CAC. The rumor was, oh, he doesn't care about it, the Child Advocacy Center. So does part of the head state's attorney for each jurisdiction needs to be more proactive in getting the federal funds, the federal VOCA funds for the CACs?
Well, just to be clear, VOCA is both state and federal. So the state puts in actually a much bigger portion of it. The state now puts in a much bigger portion of VOCA than the feds do. But it's an open process now, so whoever's running the CAC in your jurisdiction can apply for VOCA funding for what they need for direct victim services. So we encourage them to apply for what they need.
Do you feel that they are doing what they should be doing? I mean, because you deal with them, right? Or
we administer the funding to them. We don't license them or anything like that.
No, but what I'm saying is you can tell who's doing what they're supposed to do and who's maybe not working as hard, right? Which communities, which counties, or you don't have that ability to assess that at all?
No, we get an allotment to fund them, and then they can also apply for VOCA funding. So we don't do any kind of oversight of them.
Do you think there should be oversight of the CACs?
Well, that's a big question that I think
Well,
people are thinking
I know I'm getting into
about.
policy, but I guess what I'm wondering is that,
They do have accreditation, sorry to come to you. They do have their own accreditation.
They have their own accreditation, and I think the professionals who work there have all their own accreditation, and
Yeah, and GOCAP, as I understand, is not responsible for their accreditation standards.
we are not.
Okay. All right. Any further questions, colleagues? Sorry, I did not mean to. I was not trying to shut you down there. I knew where you were going. I was trying to get us there. Okay. No worries. We spent ample time there. I have a couple questions. First, I would like to hopefully see if we can follow up with my colleague's question on this per child thing. That's a question that was brought to us. And I understand there's multiple vehicles that our child advocacy centers can go to for funding. But as you can imagine, seeing those figures being brought to us and representing the communities that we do, that's concerning. So we would, if you guys could look into any per child, even for the direct amount that they get, amount that's awarded compared to specifically Virginia and Pennsylvania. If there's any differences on their funding vehicles versus ours, we'd love to see that. So a couple questions that I have. First, can you walk us through the process GOHAP has gone through in trying to address the high number of returned funds? Obviously in this climate we have, we're trying to save all, particularly the general funds that we can, but at the same token, when we appropriate funds, we appropriate them because, we want them to be utilized for that purpose. So if you can address that a little bit for us, that'd be helpful.
So I'll start, and then I'll let Sylvia add to it. I think what happens is we award money. We work with our subrecipients throughout the year. We hope they spend 25% per quarter, but that's not how every agency spends the money. And so, but we do track it in our quarterly reports. I just sent an email out to staff about a month ago that really talked to the staff who work directly with the subrecipients should really be working with each agency who are not spending a quarter, each quarter, to see if they're going to spend the money. But lots of times an agency says, yes, we're going to spend it. You get to the end of the year and they don't spend it. Even if we give them an extension, sometimes they take the extension and don't spend it. What we hope is that the agencies spend their money. If they tell us today they're not going to spend it, let's say a VOCA recipient says, there's no way we can spend it, they can de-obligate the money to us and we can award it to another agency. But if they don't tell us until June 30th that they're not spending the money, there's nothing we can do with it. So we're trying to, by having more staff who work more closely with our subrecipients, we're trying to develop really good relationships so that we can understand how they spend and try to track it better and have a better idea of which agencies really do spend their money in the end and which ones typically have returned money, and try to work from there. But I'll ask Sylvia if she has any other thoughts on this.
Well, the other thing we have done is implemented a lot closer monitoring, and we do monthly reconciliations between each grant that goes out and what's in the system and the appropriation to make sure that the spending is where it should be. And we check with everyone if there are major issues, and we try to encumber all the funds that we know of. Unfortunately, just like Ms. Lennick stated, we can't always predict what it's going to be. We try to, be proactive, but it doesn't always work. Sometimes it's also that they can't spend. There could be procurement issues, hiring issues, or they just can't spend it in time.
Yeah, we made a number of changes last year too that I can imagine also probably contributed to some of that as we were moving, I think, the award schedule to our fiscal year schedule. I think some of the other grant making challenges that I can imagine, which.
And we did last year, we did give, under VOCA, we allowed agencies to spend into the first quarter of the next year. So they could do a no-cost extension, and we're going to do that again this year. But the only problem with that is then it sometimes puts the agency, they're not spending them quickly enough again. But we're really trying to have much better relationships with our subrecipients to work with them to see if they're going to spend the money. That's one of our big projects this year.
And that's a great segue to like the number of audits. You know, so have you all been increasing the number of audits on grantees and subgrantees since the June 2024 OLA audit?
You're saying, have we?
Yes.
Yes, we have. We actually have an audit team in place now that wasn't there before, so yes.
Okay. And what does the current like oversight and accountability process for those vendors like entail?
Unfortunately, I'm not sure, but I can check for you and get back to you. I haven't really, that would be the audit director's question, but I can check for you.
Okay. I have a couple others. And first, I want to say that progress on hate crimes is really great to see that, by the way. In another life, when, you know, I doubled as a lawyer on the Judiciary Committee, we worked very hard to update our hate crime laws. So to see the progress you guys are working there is very good to see. I saw that there's changes in the violence interruption, the VIP money, and I just want to know how those changes that DLS shared, will that affect implementation at all of those programs, particularly it being equitably spent? Last year, there was a legislative ad by me for Capital Region to scale their VIP program that they're doing. Is going fantastic. Currently, they are bringing together a number of national experts to really help us wrap our arms around our shooter issue, specifically in the Inner Beltway of Prince George's County, in the shadow of Washington, D.C. So I just wanted to make sure with, I think what I saw with some of the changes to the VIP program, that there'll still be equitable funding of that across the state.
Yes, that's our plan. When I get the breakdown of how the funding's going, one of the big things we really look at is the geographic, how the money's being spent throughout the state. And I'm always asking, how come this jurisdiction isn't getting money, or why is this grant going to someplace that it doesn't feel like it should go? So it's always something we're looking at.
I'm really glad to say that. You know, seeing the reduction in homicides in the city, we've all been very happy about that, and other places. It's not your responsibility, but there was a similar reduction in Washington, D.C. We have trailed that in the Washington suburbs, unfortunately. So we desperately need that, and I look forward to continuing to partner with you on that.
It's something we're all focused on.
Yep. And of course, you all implemented the grant for choice at UMBC, which is very great. I did a tour of them over the interim. They are very happy with that, along with Vehicles for Change, who are training returning citizens on to be vehicle operators and whatnot, and giving them real jobs quickly in our region. So I think Maryland is modeling the type of change we want to see. I just want to thank you guys for your efforts there. Colleagues, any further questions for Delegate McComas?
I apologize, Mr. Chair. Just real quickly, I don't know if you've ever heard of the program called Be Kind, and I think it was done in Howard County about civility. And I know we had that 4 or 5 years ago. Our library sponsored that. But it's a good idea to get programs out there that kind of dampen everybody down a little bit so that they're, you know, not as frustrated as we all are. I should practice what I preach, but just something to look into as regarding the issue of the hate crimes and just the environment, to get everybody to kind of just, you know, you can make your pitch without being obnoxious. And I think it's something maybe you all might want to look at to see if there's any use of it as to what the chair is talking about, the hate crimes and everything. So thank you. Thank you, Mr. Chair, for that.
No problem. Thank you to you and your team. Looking forward to continuing the conversation. There's no further questions from my colleagues. Good to see you all. We'll talk soon. Thank you. We do have testimony from, I want to say, 1, 2, 3, 4, 5 folks. So I will invite you all up to begin at your, in the order you all see fit, maybe who gets there first. There's 2 minutes per person, just so you know, and then afterwards, my colleagues will have questions. So Amanda Rodriguez from Turnaround, Stephanie Powers, Care Healing Center, Lisa Jordan from MCASA, Jennifer Pollitt Hill, Maryland Network Against Domestic Violence, and I also have Jennifer Whitten with LifeBridge Health. I guess you're going to begin, Amanda, or don't everyone jump at once?
Mr. Chair, members of the committee, I'm Amanda Rodriguez, the CEO of Turnaround, a domestic violence and sexual violence service organization. I'm also a lifelong resident of Prince George's County. We provide life-saving support for victims in Baltimore City, Baltimore County, and Howard County. We're here today because of the $10 million cut to the Victims of Crime Act funding source through GOCAP, which threatens critical services that save lives. If these funds are not restored, victims in the most desperate moments will be turned away. Calls to our hotline have increased by over 30% this year. Demands for crisis intervention, counseling, housing, and legal services continue to rise, yet we're being asked to do more with less. We are struggling to hire and retain staff, and our therapy wait list has exceeded 50 clients in this last fiscal year. But this is not just about statistics. These are about real lives. On Christmas Eve, a mother in Baltimore County watched her 4-year-old son be murdered in front of her after she was shot in the back of the head by her abuser. She's now receiving comprehensive services from Turnaround, and it's because we are there and able to do that because of the very incredibly needed VOCA funding. We've lost 4 survivors to overdoses in the past 2 years, people trying to numb the trauma of sexual violence. IPV, intimate partner violence, sexual assault, and human trafficking are gun violence. And we are responding to homicide victims' families, and we are serving individuals struggling with addiction in our communities. Imagine if no one answered the call when a survivor who was just raped needed to preserve evidence that is literally on and inside of her body, or when a domestic violence victim was ready to escape, that person had nowhere to go. Restoring this $10 million to VOCA is not just an administrative decision, it is a moral one. This is funding that is the difference between hope and despair, between recovery and continued trauma, and too often between life and death. We urge you to act now with urgency and compassion. Survivors are counting on you. Thank you.
Good afternoon. My name is Stephanie Powers, and I'm the Executive Director of the Care Healing Center in Carroll County. We provide services to survivors of sexual assault and human trafficking. I'm a licensed therapist, and for the last 19 years, I provide services to survivors in Carroll County and Harford County. I've had the privilege to stand with survivors and see that by holding hope, we've given people a sense of safety when it has been unjustly taken from them. Over the past year in Carroll County, we have seen the demand for services increase at an alarming rate. We have had a 25% increase in accompaniments, a 49% increase in crisis intervention sessions, and have already surpassed the total number of clients served this fiscal year from last, with 4 months left to go. The demand has grown so much that we have had to hire 3 additional positions this year: 2 on-call medical advocates who attend sexual assault forensic exams at the hospital, and a full-time children's counselor. As much as we don't like to think about it, so many of the clients we see are children who are sadly being abused in their own homes. This specific type of betrayal and trauma require highly trained clinicians who not only treat the child, but also work with the entire family unit that is now in crisis. One such family that we're working with is that of a 5-year-old who we first encountered during their forensic exam when they were sexually assaulted by a family member. Our extremely seasoned head of forensic nursing at the hospital described this exam as one of the most troubling she's ever had to perform in her career. The 5-year-old didn't even have the vocabulary to describe her own body parts or what had happened to them. The child was withdrawing, having nightmares, and acting out at school. Their mother was also as equally distressed and was experiencing strong feelings of guilt and failure. Because we have a children's therapist trained in trauma-informed and play therapy modalities, we've been able to intervene early, helping the child find her voice, rebuild trust, and begin healing. She's learned body safety, safe adults, and correct terms for her body parts. We've also been able to help her mom navigate her own trauma, as well as legal processes. This is a perfect example of how one client utilizes all of the services our agency offers across the spectrum, and how we cannot afford to cut one specific position or department. Without the specialized supportive services our agency offers, families and children are at a far greater risk of developing lifelong challenges, including substance abuse, chronic health conditions, and severe mental health struggles, issues that not only devastate lives, but can also place significant financial burdens on the state. Reducing this funding would force us to scale back on services precisely when clients need it the most. Our communities depend on these services, and with your support, we can continue to provide them. Thank you for your consideration.
Good afternoon, Chairman Lewis and committee members. I'm Jennifer Pollitt-Hill. I serve as the Executive Director of the Maryland Network Against Domestic Violence. MNADV is the federally recognized state domestic violence coalition for Maryland, and we work to coordinate the 24 domestic violence programs around the state. So we hear every single day from our member programs about the challenges that they face in responding to the increased demand for services that went up during COVID and have never gone back down. And the new work norm of virtual work, which can't be implemented in a direct service agency, along with the increased costs of living, put a dire strain on our program's ability to maintain a trained workforce. And of course, the current insecurity of federal funding streams adds really an unbearable amount of pressure on our service providers. Now is not the time to cut funding. Last year, our DV programs answered 41,000 hotline calls, provided over 100,000 bed nights for families fleeing violence. And a cut to state VOCA funds means that we're going to have about 20,000 shelter beds that go empty and 10,000 calls for help that will go unanswered. In addition to the VOCA cut, this budget also eliminates $1 million of GDVC funds, which means that our comprehensive domestic violence service providers will lose a third of what the state earmarks, especially for DV services, and that will be on top of proposed VOCA cuts. So we need funding restored, and we need GOCAP to be as flexible as possible with how they administer these funds. So strategies such as no-cost extensions, removing caps on some of the administrative costs. We fully support better staffing because we realize that the monitoring that Ms. Lennig talked about is only done with humans that need to interact and know what the needs are of those subgrantees. We have seen a pattern of late awards and late responses to requests for no-cost modifications, and that does contribute to some of the reason why funds are being returned to the feds and the state. And so we know that GOCAP is working very hard to remedy these issues, and we urge them to move forward and keep going. So continuity of funding levels and support for time-tested, effective service providers will ensure that Maryland's safety net stays intact, and it will save lives. So we urge a favorable report with some amendments. Thank you.
Good afternoon, Mr. Chairman, members of the subcommittee. I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're the sister coalition to the Maryland Network Against Domestic Violence. We work closely together, and we represent all the rape crisis centers across the state. You've heard about increased demands. You've heard about workforce pressures. You're aware of inflation. My role here today is to just provide a little bit more context about what's going on at the federal level, because across the country, we have relied on the federal government for support for sexual assault and domestic violence survivors. So at the Maryland Department of Health, they've not received their award for rape prevention and education money yet. It should have already been here, but across the country, they have not received these awards yet. The Office of Violence Against Women at the U.S. Department of Justice has many different types of grants. Some of them go directly to Ms. Lennig and her team. Some of them go directly to the programs that we all work at or represent. They have taken down all of the application announcements. So, and for the people who were working on things that were due, kind of now or next month, they've said, stop working on them. So we have all of those federal funds that could possibly disappear. The funds for the Federal Family Violence Prevention and Services Act are also uncertain. That's on the HHS website, where they simply say that the program is no longer current. This is $7 million or more that we really can no longer rely on. The ARPA money, you might not think of these programs when you think of ARPA, but over 2 years between the domestic violence and sexual assault programs, that was $10 million of direct services for survivors. You also have the cut that Ms. Pollitt-Hill mentioned, the $1 million for domestic violence programs. You have a similar one for sexual assault programs, and CACs moved from having $650 million or $650,000 of general funding down to 300. So there are cuts after cuts after cuts, but by far the largest source of support for our programs is from VOCA. And that is why Chairman Barnes and Chairman Gazzoni passed the Victim Services Stabilization Act, is that the money from the feds was going up and down and up and down and then started going down. And Maryland made the policy decision to say, we are going to say $60 million for these programs. And you heard Ms. Lennox say that is still far from sufficient. She got $80 million worth of requests. And it is just unbelievably disappointing to see buried in the BRFA without even really a full hearing, because we all work here, we know what buried in the BRFA means, that they want to take a $60 million floor and change it to $35 million. You know, yes, there are problems at the federal level. That's exactly why that law was passed, because we don't want to let the mess in Washington affect the survivors in Maryland. We want to say, let's keep this money level. I also, as the representative of the Rape Crisis Centers, have to also mention the Rape Kit Testing Fund. So keep in mind, Maryland inventoried 6,000 untested rape kits. 6,000. And although we have devoted some federal money and some state money to getting that backlog down, we really don't even know how many we have left, but we still have a lot of kits left. And this idea that we would have money devoted for rape kit testing and we would take it back and put it into general funds before we're done with the job, I really ask you to reject that idea. 2 years from now, 3 years from now, if those kits are all tested and we've sought justice for survivors, go ahead and look and see what's in the special fund. But right now, taking out $5.7 million, now I know that they're saying, oh, we're taking out 5.7, but we're putting 3.5 back in, I guess, so it doesn't appear that we're cutting rape kit testing, but you're taking out $5.7 million before the job is done. And we ask you to finish the job there. And before I stop, I have to say, you know, the budget has $187 million, $187 million in enhancements. There are increases in personnel, which sound like they're justified, for GOCAP and for some of the other agencies that you've heard today. But you are making choices. It's not like every single thing is being cut because of the budget crisis. You are making choices. And so we are asking that as you make choices, you don't choose to cut funding for victims of crime, for victims of domestic violence and sexual assault and child sexual abuse. You can make better choices, and that's what we're asking you to do.
Questions, colleagues? We will talk to this panel, and then we'll replace. So the last one. The only thing I will add, just for anyone who's watching too, all this analysis is based on the governor's budget that's been presented to us, and I'll just state for the record, there's things in there that I think many of us are open to, things we are less open to. We are actively looking for savings for a number of different programs, but we have not had in a couple weeks we will have our thumb on the scale, but this is not this body's budget as of yet. I just want to be clear. I'm going to go to Stanko first this time. Delegate Stanko.
So first off, thank you all for coming today. And I'll start with a quick statement, which is appreciate everybody here sharing the impact. Obviously, it's in the moment of Ms. Powers, thank you for joining specifically in the work you do in Carroll County and Harford County. Can you share, just to contextualize for me, what would the rough, and if you don't have it today, that's okay, we can follow up, but rough estimates on how much what that cut would impact to the care center?
Sure. If it was, so what percentage is that we're talking about then?
17, 20.
So a 20% cut, so I'm not a mathematician. You'll have to figure, I'll follow up with you.
Great.
But again, so I know with the cuts that we're talking about, it's putting the onus on the agency to engage in being more self-sufficient. So more private donorship and relying on ourselves, which again, that is our responsibility. But sexual assault is something across the board that no one likes to talk about. When you go to these fundraising events and you tell people what you do, the answer that you get is, I can't believe that's what you do. I could never do something like that. And while that's very true, somebody has to be there to do the work. And it's getting the information out to the people that need it. And again, sexual assault is something that always happens behind closed doors and nobody wants to talk about. So fundraising is not easy to do for those kind of things. So if our federal and state funding is going to be cut on that, so many people are going to suffer. And just how we were saying with the Child Advocacy Center, trauma therapy for a child is very highly trained. You have EMDR, trauma-focused cognitive behavioral therapy, and paying a clinician at a nonprofit, you're not making the big bucks. That's why so many therapists at these agencies are master's level clinicians that are trying to get their hours, and the moment they get their licensure, they go on to private practice. So by increasing the available funds, we're able to maintain these clinicians that have these special licensures to be able to get these children the special treatment that they need to be able to kind of nip the treatment in the bud, so that way these are not the stories that they carry with them throughout their lifetime. This is a chapter in the book and not these children's entire story.
Yeah, absolutely. Like I said, I know I put you on the spot there. If we could connect offline, that would be fantastic.
Absolutely.
Thank you.
Delegate McComas?
I'll just make this pretty quick. Yesterday, we had a hearing with a lot of people in the joint hearing room about the fact that if we didn't fully fund the collaborative work that the teachers would be able to do under the blueprint, that we were really going backwards. And I guess my question to Ms. Jordan or any of the panelists is, okay, let's say we just can't take care of all these people that have either been raped or sexually abused, children. Obviously, you're in that business, so you kind of know what happens if it isn't taken care of in a proper time. So if you could just briefly explain that, so we understand that, because we're going to have to make some policy decisions about the money, and I sort of feel like, well, they need shelter, they need food, and they need to feel okay, and that's more important than a world-class education. Maybe we just need a competent education. I'm just throwing that, I'm just kind of giving you, basically how important is this? And if we don't do it, or if we don't help these people, what's going to happen to them?
Yeah, thank you for that, Delegate McComas. Child poverty will increase because children will not be able to get their education because they will be so traumatized that they will not get an education, they'll drop out of school, they won't go to college, they won't get good jobs. People who won't be able to get shelter like their moms are going to become homeless. So you're going to have children and their families and their mothers living on the street. You're going to have people facing major mental health crises throughout their lives because, one of the things that we try to do is heal people and give them strategies so they can cope and they can continue on with their lives. And if that doesn't happen, the effect of the sexual violence continues. The effect of the domestic violence continues throughout their lives, and it never resolves. This is something that we can help people with. It is, as my colleague, Ms. Powers, said, something that we can make a chapter instead of the entire book. So it is cost effective to provide these services. It is the moral and right and ethical thing to do, but it is also cost effective. And so I want to be sure, because we're talking so much about money this session, that people understand that there are financial implications to all of this, and the time to act is now, not a long time from now. And the reality is sexual abuse will continue. Domestic violence will continue. If I say to a mom, I can't get you housing, I can't get you a divorce from the abusive stepdad, I can't get you part of the pension that you're entitled to, and her choice is going out on the street and living with her kids in a tent or putting her kids in foster care, she's going to think about staying, and we are going to be complicit in that. And we shouldn't do that. We know how to make things improved and better in people's lives. We know how to do it. We just need to have the will and allocate the funding so we can.
If I could add one other point to that.
Sure.
Housed within our comprehensive domestic violence centers are also our abuse intervention programs. VOCA dollars cannot be used to treat offenders. So our programs rely on state funding to support that. So if state funds are cut, folks will have to divert funds or not provide abuse intervention services. So that's another impact of these cuts to the landscape.
No problem. So I have one question, because we are like increasingly responding to everything happening down the street across every conceivable service and program that we have. I guess, how do I ask this? What pressure is being brought to bear down the street from, I feel like, your various coalitions across the country? I'm not, please receive it, I'm not conveying this, that's you guys' responsibility. But it is quite challenging, I would say, as a state. And I was here when we passed the bill that was led by Chair Barnes and Chair Gazzone, and I was here in Judiciary Committee as they started to make their retreat federally of funding this. And I just wonder, because I know what we're doing and giving our Attorney General a lot of pens to defend our values, but if you could speak on that, I think we would appreciate it.
So I think it's a work in progress, Mr. Chairman. I think that just as Ms. Pollitt-Hill and I are here because we represent the coalitions of programs, each of us sit on kind of the national equivalent. So there's a coalition of sexual assault coalitions, there's a coalition of domestic violence coalitions, and those groups are kind of helping all of us navigate the tension between wanting to speak out about what's going on and the fact that some of that money comes from the federal government. And there is a genuine and I think legitimate fear that speaking out will result in retribution and programs will be shut down. So I think that people are still figuring some of that out. But they are helping us communicate with our congressional offices. I can say, and really have to shout out, Congresswoman Elfreth reached out when all of the funding was shut off to make sure that we were doing okay. There is also a fairly robust effort of all of the nonprofits working together, from the National Council of Nonprofits, and some of the lawsuits that have occurred have been organized through them. So I think that the reality is we still don't quite know everything that is safe to do, but nobody is shutting up either. Like, none of us are doing this work because, we've worked together for a long time. I'm not going to stay quiet. But I hear your question. I can assure you that people are talking about it, and I think the strategy will develop as we go along, particularly as we go along to March.
Thank you. Colleagues, any more questions for this panel? Delegate Schindler.
Thank you, Mr. Chair. I ask this, and I think I can infer the answer from the testimony that was given, but kind of a low-hanging fruit for us when we're looking at ways to cut, to create efficiencies, is when we look at accounts where money haven't been spent. So if we look at an account that's had a positive balance that hasn't been spent for a few years, that's sort of an easy indicator of a way to create an efficiency for us. So when you speak of the $4 million for rape testing kits, that's proposed to be removed, and then another $3.5 million to be provided in the next year's budget, can you kind of speak to that as to why that shouldn't kind of be a low-hanging fruit for us?
Yeah, no, thank you for that question. It's also related to the federal funding that we were talking about. We have, since 2018, had a couple of federal grants. The state actually has struggled to completely expend those dollars, but that is for the backlog. That's for the 6,000 untested rape kits, and there are more, because we've now found there are more kits from the Department of Corrections. There are other kits that somehow didn't make it into the inventory. So there are more rape kits that are untested, and they're in the process of being tested. The $3.5 million, that's for like today, now. The kits that are required because someone in your community is being raped. It can be used for the backlog, but it's also kind of currently required funding. I think that at some point we might have tested the 6,000 rape kits, and at that point, look at that low-hanging fruit. But right now, I have zero confidence that we're going to get that funding renewed in the fall, right? So you're going to need to use that low-hanging fruit, the $4 million, to continue the work on the backlog. Could be wrong, but just given everything, I don't think that we can assume that federal money will be available. So hang on to your state dollars, because we've told those survivors we're going to test these kits. Let's not go back on our word.
This goes without saying, but thank you all for what you do every day for people in Maryland. It's a hard job. We say that a lot, but hopefully you know that we do mean it. And in these challenging times, we're going to try to find all we can, the savings, to protect a lot of core programs. So, I can't make promises of yet. There's supplementals coming down. We're going to see what those look like too, but we're trying. So thank you all. I know we still have one more, Jennifer Winter from LifeBridge.
Thank you.
Thank you.
Good afternoon, Mr. Chairman, distinguished committee members. For the record, my name is Jennifer Witten here in support with amendments to ask you to, consider the proposed cuts. You heard from my colleagues. Again, I'm here representing Center for Hope through LifeBridge Health. We're one of the largest child advocacy centers. I appreciate the conversation today around the funding and the infrastructure for those programs. To say that the cuts with VOCA and VIP and the CACs would be more than significant. I think you've asked a lot of good questions here today about what is our capability in terms of if those cuts happen. And the unfortunate piece about many of these programs is there's no really other revenue streams for us to seek reimbursement for these core services. So as my colleague said, we work to spend and be judicious with the monies that we do receive from state and federal grants, but we also work very aggressively to get philanthropy dollars and other funding to support the services. And so you may see a variance across the state determining on the services, but that's really based on the resources available. We also run, I heard Mr. Chairman speak around some of the violence intervention work. Good to hear the positive start in the work in the Washington corridor. We also manage some of the largest sites in Baltimore City, and we can be here before you all today to say we've seen tremendous results in those programs over the last year. In 4 of the most, I would say, highest homicide rates in Baltimore City, we have seen 0 homicides. We can't contribute that to all of our programs, but we have seen significant improvement. We've had almost 900 violence intervention work. We've worked with over 7,000 individuals throughout the community. Just at Sinai Hospital alone, we have seen a reduction of 52%
gun homicides, and we were able to confirm that with MEMS and others that is related to the intervention work in the city. So we know it works. So what we're asking is let's not consider cutting that when we're making huge strides. To the other question around that early intervention, what we find is either with children or those engaged with violence, when we can do that early intervention and get them redirected and get them the supports that we need, we continue to see less reduction of additional violence, because typically what you'll see is if somebody's assaulted or has witnessed aggressive violence, they will often be repeaters. I think I read a statistic somewhere that in the state of Maryland, we spend over $1 billion a year related to just gun homicide alone. So I know it's hard to make these budget discussions and decisions, but I think, you know, the cost that it provides to our jurisdictions and to our communities is significant, and the investments, although be it, we would probably say we would like to see more investments in these programs, it's really significant. So we hope that you call upon us. These are just vital services that we provide in the community, and you have my written testimony as well. Happy to talk about child advocacy centers, very woefully underfunded, but it's a critical service that us and many of our colleagues across the state provide. So with that, I'm happy to answer any questions.
Thank you, and it's good to see you. Colleagues, any questions for Life Ridge? Well, thank you for coming. For everyone, I know there's a number of people who had just written testimony who I know are probably tuning in. Thank you all for your testimony as well. We have a lot of work ahead of us. I appreciate you all taking the time, and we're going to get back to it. Have a great day.
Thank you.
We are adjourned, colleagues.